Have you ever wondered to yourself, how long do I have to take these bone-building nutrients? You know, I'm asked that question probably once a week, and I always say, well, it depends how long you want to really work on developing very strong bones. It's sort of interesting, the older we get, the actually more we need these nutrients because we absorb, our digestion is weaker, our assimilation is weaker, we don't absorb the nutrients so well. We also have a higher demand because the body doesn't repair as well. And of course, the older we get, the more we accumulate toxic load from pesticides, plasticizers, many heavy metals, many toxins. It's always my answer, we should keep up and actually build our bone program as we get older. Now, of course, you may start out with a really strong program, many nutrients, alkalizing, doing the exercise. Then you may get to a level where you're pretty stable, where you're not losing bone. So you may say, I'm going to cut back a bit. You may change your diet and say, now I'm getting a diet with much more calcium or much more magnesium or much more zinc, so I don't need so many supplements. But take care. Generally, having a problem with bone health means that we aren't delivering enough nutrients. So I personally plan to stay on these nutrients lifelong, and that's my suggestion to most clients. Okay, have some fun with it. We'll talk later.